trust me when I say this, most of the
Yeah.
kids don't have sensory issues as such. Kids explore things by touching. That's why we say hand is the gateway to the mouth. If your child is not comfortable to touch something, they're not comfortable to eat it. Some parents, they keep cleaning the mouth, they keep wiping. Do not do that. That can itself develop oral aversion. 90% of the time, they don't have any underlying issues. It's only about the 10% of the kids who might actually need feeding therapy as such. Say the child is going through a normal developmental phase, maybe teething, or the child is sick, or the child is going through new food phobia. You're literally force feeding your child. Now, feeding this experience as a whole can be very traumatic. Now, every time during meals, the child is going to get reminded, okay, this is mealtime, this is how I should feel. Increase of cortisol level, the appetite is gone. So, first thing is be very neutral.
Hey parents, welcome to another episode of the Modern Indian Parent Podcast, a podcast that is redefining parenting in Indian families. I'm Sanchita Daswani. I am a pediatric nutritionist, and every week we bring you episodes to help you own your modern parenting choices, even if Nani and Dadi don't agree with them. In today's episode, we are joined by our guest Thara Shenoy. She is a pediatric occupational therapist that specializes in pediatric feeding issues. And in this episode, we are going to be talking to her all about feeding issues and sensory issues, because we have seen now as parents, this is on the rise. And for us as parents, we really want to understand, why are they on the rise? Why is this happening? Why are mealtimes so complicated, and why are kids not just accepting food easily? So we're really going to break it down with her, because she's had over 14 years of experience. She's worked at a school for over 8 years, and she has helped parents and professionals around the world when it comes to picky eating, milestones, and handwriting. So let's welcome her to the podcast. Welcome, Thara, to the Modern Indian Parent Podcast. Thank you so much for being here. How are you doing today?
I'm great. How are you?
I'm good. We have been working together for a few years. We've been in touch, I think, since I started my journey as a child nutritionist. Because,
Yes.
Today, for a lot of parents, we are dealing with picky eating, feeding issues, sensory issues. A lot of these issues have come about, and we know that you are an expert on that. So we are looking forward to hearing all your thoughts. So again, thank you for being here. And let's just get into it. Can you tell us first a little bit about yourself and how you even got into this field?
Yes. So basically, I am an pediatric occupational therapist, and before pandemic, I was associated with a special school, and there I have seen a lot of kids having feeding difficulties. Right. So this was my start, wherein I wanted to do something for them, and that is when I went ahead and did a lot of courses, a lot of certification to help them. So that is where it started.
Okay. And it's so interesting, because when we talk to our parents, or when our parents see us with our kids, they sometimes think we're a bit crazy, because the amount of attention we're giving and we're noticing all these things. They're like, but you guys never had these problems. We were just
Yes.
feeding you and it was fine. So, what I want to understand from you is, are they right? Did they just not notice it? Or why is suddenly all these sensory issues on a rise?
Yes. So if you really see back then, most of them were in a joint family, right?
Hmm.
So it was not that one person handles the kid. Somebody will come and feed. The child is always on the go, and they used to not even observe what the child has eaten. Okay, you're not eating, drink some milk and done, right? So it's not like that. Everybody is nuclear. So one parent mostly, or a caretaker, handles the child. And definitely, like
Hmm.
you asked, sensory issues are on the rise. Yes, the reasons are many, and many of them are unknown as well. And also, we are getting better at identifying and diagnosing sensory conditions now. And there is this generational differences. I remember as a child, I got a lot more unusual sensory experiences, and we
Hmm.
are currently meeting, a generation of children who are exposed to screen time very early in their life, and they're more passive, and well, compared to previous generation. And all our early sensory experiences, they underpin our brain wirings. and which is the base for our sensory development of sensory system, and shrinkage of outdoor play areas. I still remember my grandfather telling me stories of how he used to play. They used to like literally cycle and cycle miles together, go to another city, play with their friends, cousins. Then comes my dad's generation, where they used to go out on fields, fairs, a little bit far away from house and play and come back. My generation, where I used to play in my neighbor's house or the other lane. Then came the generation where they used to play outside their house, and now kids are not even going outside their house. Even if they have outdoor space, they are passive, they are inside. And we need to arrange play dates for them to even go out to this play areas and all that. How often do kids do that? Literally every day we used to come home with dirty clothes, roll on the floor, and so even studies say that the previous generation, we used to at least spend 4 to 5 hours outdoors, and now if you
Yeah.
see, the average is about 30 to 40 minutes. Maybe that's happening in the school, and they're spending 9 to 10 hours seated. And then there are many other reasons, like environmental things, and pollution, toxins, and the lifestyle, food, and all also so many unknown things, factors as well. Things are very much different now than how it used to be. So all this can contribute to sensory issues as well.
Yeah, you're so right, because when we think of how like our parents and grandparents used to play, they didn't have any toys, and also they had to go outside, and just with whatever they could find, they would play sport, they play cricket with whatever
Exactly.
bat, and I think they were exposed more. So I think the main thing you're saying is that we have less sensory stimulation now in today's world, and especially those COVID babies who were bored and really stuck inside. And even I read somewhere a lot of the advice, they're like, okay, make sure your kids get at least 1 hour of outdoor play a day. Like it's literally come down to that, where we're like, okay, at least try and get that 1 hour at least, compared to when our parents and all were pretty much spending all the time outdoors. So
So
that's so true. Yeah.
you won't
Yeah.
believe it. I tell parents, if you don't have outdoor space, even that is okay. Inside, make them do something, some gross motor activities. Because parents, we
Hmm.
can't send them out. Of course, things are different now. The safety, everything matters. So do it at least inside the house, animal walks and all those things.
Yeah, I think it's important for us to not make those excuses in terms of outdoor. Now we say, oh, it's raining or it's snowing, or air quality, especially in India,
Mm-hmm,
has become
mm-hmm,
so bad. So they refuse to take the kids outside, but you can still make do with it inside. And the other thing which I found so interesting, what you said, is that back in the day, as parents, it wasn't one caregiver. Everyone was kind of handling the child. And I think now, as moms, we're so paranoid. We're like, we are going to be there for every meal, every play date,
exactly.
everything. So
Yes.
I think when we take it all on, we start noticing it. Can you identify to us what is a sensory issue? Because I think all kids go through developmental stages, they're learning, they're growing. But at what point do you identify it as an issue? I don't know if that's what you like to call it, a sensory
Mm-hmm.
issue, or could you define that a bit better for us?
So, when a child, has sensory issues, it will impact a child's overall development, right? So, we all have different senses in our body, like sight, smell, touching, and
Hmm.
hearing, auditory, and all that. So, it needs to be balanced. So, when I say sensory issues, these, the sensory modulation or the way they regulate themselves, somewhere there is imbalance. So, either the child will be hypersensitive, hyper responsive, wherein even a little stimulus can trigger them. On other spectrum, there are uh, hyposensitive kids, or seekers. They seek for all this sensory stimulation, maybe putting things in the mouth, or they want to keep touching things, or they want to keep moving, or always on the go. So these things. So if you feel that this is causing problems in your child's day-to-day activities or in school, so you can assess your child for sensory processing issues. Thereon, the specialist will guide you on how to move on further.
So, what you mean is that if your child is doing an activity or engaging in a situation and you feel that they are struggling with one of their senses, meaning in the sense like, would you say, like, if they can't, if they're getting irritated, that they can't see it or feel it, or if they have to touch
Mhm.
something and they get upset, that would be
Mhm.
a sign?
That would be a sign. See, now
Hmm.
many kids, especially toddlers and preschoolers, they are always up on the go. They don't like to sit. So this can
Yeah.
also be, age
Hmm.
appropriate typical, because these
Yeah.
days I hear a lot of parents tell that, my child is hyperactive, right? Now, it can be, the normal developmental phase where the child is exploring and that's how they are. So, this you can rule out when you do an assessment. So, if you have a doubt that, okay, something is not
Yeah.
right, my child is not able to focus, the child is having frequent
Mm.
meltdowns, is not able to cope up, you can get screened, right? So, it's good to, if you have that in your mind, it's good to, just rule that out.
Yeah, so I think that's what you're saying. So you're saying that you can have an assessment to understand if
Mm-hmm.
it's normal or if there is actually something you need to work on. Because I know, like, when kids turn 1, they want to walk around, they want to run around. They don't want to sit on that high chair. They're not going to sit for 20, 30 minutes like they used to. So it's for us to also understand as parents that that is developmental. But if it's something that is really coming in the way of their daily routine and it's a continuous pattern, then it's important to kind of seek
Exactly.
further
Yes.
assistance. Like I
Mm-hmm.
remember
Yes.
my son, every time he would be in front of like a lot of colors, he would have a tantrum. So we used to have those colorful play mats, and every time he'd get there, he'd start like screaming and yelling and being very upset. And my daughter would be sitting there, and she was totally fine. So then I think what's really important is also for us parents to follow your gut. Like if you as a mother feel something is off, it's just important, and we're so lucky we have help today to find out. So I just felt like something is off. Like
Mm-hmm.
how is he getting so upset? It's not that many colors, but it was troubling him, and other kids are okay. And then when I went and I assessed, I found out he actually had major gut issues, and that was affecting his brain and all of that.
So don't wait. If you have that gut feeling, do not wait. Get it assessed.
Right, because a lot of parents, they say it's okay, they'll grow out of it or they'll
Yes.
be fine. So do you feel that it's okay or it will just get worse?
So see, I do not, recommend this wait and watch approach at
Hmm.
all. Even in
Hmm.
other milestones like be it speech or motor milestone, this is one thing in common that we hear from parents that, okay, I also did that late. He will do it. Let's
Hmm.
wait till he's 2 or 3 years old. So yes, you did it. That doesn't mean that, you have to just wait. So just going and, having a assessment done, sometimes they just need a push. Sometimes it is just
Yeah.
that push and right techniques wherein they will, overcome it. So it's always better to not use that wait and watch approach.
Yeah, I agree. Because even my son also, by 2, he wasn't speaking, and everyone said, wait till 2, wait till 2. So we're like, okay, fine. Because also at that point, sometimes you don't know what to do. And then we waited, and then I was like, you know what, what's happening? And we went to a speech therapist, and literally within like 2, 3 weeks, he started speaking because he needed that push. He needed that
Push, yeah.
attention, to focus on those words, to have that feedback. And it
Some
helps.
right techniques.
Yeah, right. And even when it comes to meal times, everyone says my kids will eat by themselves or they'll figure to eat everything else. But the reality is that so many of us as adults have issues with food, and also it is something that it's better. I think we've learned that preventing is better than
Better
reversing. It's
than,
much
yes,
harder
exactly. Yes.
to reverse. Okay, so let's talk a little bit more about sensory, because especially nowadays you hear everyone saying I'm going for this sensory class, that sensory class, and I think as parents we've understood the importance. So could you guide us in the first 6 months before even
Mhm.
starting solids and the beginning, what sensory experiences would you advise for parents to have their child partake in? Do they need that, all these sensory tables and all of this stuff, or can it be simple?
So a child's sensory system, it is rapidly developing and filling up with information. And no, you don't need all these sensory things and complicated things and all basic things.
Mhm.
So make sure that your child gets right amount of sensory stimulation at right age. Now, when a
Mhm.
child does not get that sensory experiences, these kids are at high risk of developmental and cognitive delays as well. So make sure that you provide a lot of sensory experiences, and it need not be complicated. So just think of all the senses, like for example visual. So you can just start with all these contrast cards or some contrast mobile on their crib, or this
Mm.
colorful books, the cloth books or colorful toys. Give a lot of eye to eye contacts, do a lot of smiling and that animative movements of your face, auditory stimulation, for example, sing a lot of lullabies, play some, soothing music. Keep talking to them. Keep talking about, describe what is happening. Even if they don't understand words yet, keep
Yeah.
describing what is happening, what you're doing, all these things. Tactile stimulation. Very, very important thing to do here is avoid the mittens. I see most of the parents, even for older babies, 6, 7, 8 months, they just put the mittens because they put fingers in the mouth and all that. Now for a child, they explore through hands. So
Yeah.
if their hands are always in the mittens, that exploration does not happen, right? So avoid that. And once they, by 3, 4 months, they begin to grab objects, make sure you give them toys of different textures, soft, rough, hard, smooth, even temperature for that matter, warm and something cold, not really hot,
Yeah.
but warm, so they can feel that. And give a lot of skin to skin, give a lot of gentle massages. This also helps. Oral stimulation again. So from a very early time, start cleaning their mouth gently with
Yeah.
soft muslin cloth. And when they start grabbing objects and mouthing it, do not stop. Most of the parents do this mistake. They stop, right? So do not stop. Give them age appropriate, teethers or long mouthing teethers or anything like that. Also, once they start solids at 6 months, make sure you give different textures, different flavors, because that also is very important. That also is a sensory experience. And then a lot of nature exploration. Nature exploration is the best kind of sensory stimulation you can give to your child. Make sure you take them out. They're looking at all different moving things, colorful things, different sounds from birds or even vehicles or people talking. This also improves the social interaction. They see different, new faces. They see you interacting. So basic simple things can take you a long way. It need not be complicated at all, at any age for that matter.
That's so good because the way you're explaining it, for me, it is just as a parent, just interact with them, explain to them what's around you. It can just be part of, just make them part of your daily routine and surroundings. And I think today as
Exactly.
parents, we're so overwhelmed. So it's nice to hear that for their sensory, to just let them be in the environment, let them enjoy and explore with you, which is so nice. And I want to shift a little bit towards meal times because this is I think I was reading a study that they said that half of the kids today are picky eaters, and that 54% were not eating optimally, so every other child pretty much, and 1 in 10 obese kids will be from India. That's a separate fact. But a lot of these alarming facts when it comes to meal times. And when we actually look down to it as parents to understand why, a lot of it is stemming back to the relationship our kids have developed with food in the first from 6 to 12 months. And I
Exactly.
want to talk to you a little bit about these feeding issues. So, first,
Hmm.
I wanted to say is that just as you mentioned about giving the teethers, so I tell all my clients that when before starting solids from 4 to 6 months, once your baby starts putting things in their mouth, really allow them to do that. And especially
Hmm.
closer to 6 months, I tell them give the spoons so they are
Yes.
comfortable with it. So when they see it at meal times, that's so important. Now, I have seen this case with so many kids where when they start solids, they have the plate in front of them and there's a puree or finger food. And as soon as they touch it, they're like, they kind of are
Hmm.
taken aback. If a parent has reached that stage, what would you
Hmm.
suggest? How can parents help the child overcome this?
So, when a child, hesitates to touch food, the first thing
Yeah.
parents feel is, okay, my child has sensory issues, he's not touching food.
Mm,
And in my consultation, we do a detailed assessment for these sensory issues as well. And trust me when I say this, most of the
yeah.
kids don't have sensory issues as such. Right.
Wow.
And when you, especially when you start, this traditional weaning, when you follow traditional weaning, I have seen, most of the kids not getting that exposure to interact with the food, as long as, even at the age of 2 to 3. Now, I'm not saying, traditional weaning is bad or you need to follow
Yeah.
VLW. Whatever it is, even if you're following traditional weaning, which you are comfortable with, make sure that your child gets that exposure to, the food. Now, kids explore things by touching.
Yeah.
That's why we say hand is the gateway to the mouth. We have the saying, right? So if your child is not comfortable to touch something, they're not comfortable to eat it. So make sure they get this exposure, and don't worry about the mess. It will, it won't last long. So also give a lot of messy play with food and non-food items also, which are kid friendly. When you do this, definitely they will not hesitate to touch food, and this also encourages self feeding as well. One more
Yeah.
thing, some parents, they keep cleaning the mouth, they keep wiping. Do not do that as well. That can itself develop oral aversion. So that is one thing you need to definitely avoid when it comes to touching or being comfortable with sticky thing. It's all about the exposure you give.
Right. So I think if, as a parent, if from 0 to 6 months you introduce your child to enough sensory experiences, then they should be okay by then to touch and feel. They should be comfortable. And if they're not, it's okay, but just make sure you work on more sensory outside of mealtime so that they can also eventually get comfortable. And I think also for certain parents, they panic, oh, he didn't do it. But I think also we have to remember mealtime is such a new experience. Eating is a skill, so don't panic if your child has touched something and is freaking out. The best thing you do is just stay consistent and keep at it and don't force. So, yeah, keep doing it. And another big thing I've seen that helps is when you eat it. Because we
Exactly.
put ragi porridge in front of the child and we expect them to gobble it all up. But for them, they've never seen it. They have no idea what it is. But if they see you eating it, they'd be like, oh, that's how you do it. Okay, if my mom is putting it in her mouth, then it should be safe for me. I think I think for kids, if you feel they're uncomfortable with touching foods, be consistent, don't panic, don't force, eat with them and give them that time. Give them some space to get comfortable with meal times.
Exactly. So, role modeling and mirroring is one of the best technique you can,
Hmm.
implement to get them comfortable, even to try a new food for that matter, right?
Right.
Even chewing, even to show them how to chew for the chewing skills, they do
Yes. Yeah.
helps.
Yeah, and I think that's what is missing in traditional weaning, and I think that's why baby led weaning has become so
Mm-hmm.
popular
Yes.
with so many parents because of these cons of traditional weaning, because we're holding the bowl and we're shoving food in their mouth, so they have no idea what they are eating. So that's great to know about the food touching and all. But another thing I see a lot of parents struggling with is they say that my child only wants smooth puree. As soon as I make it a little grainy, they start coughing and gagging and spitting it out. So you have 9-10 month old babies who are still on that smooth texture. So, is it really that the child cannot handle it? Is it the parent not wanting to push? Is it a sensory issue or is it the normal process of eating? And how can we overcome this?
So yeah, so when a child is not able to make progression in terms of texture, it can be because of, like you said, sensory issues. It can be because of underlying oral motor issues. It can be because of severe reflux or GERD.
Hmm.
But most often, again, it is lack of exposure in the first year or that early years when they start solids. So see, all babies have this phasic bite reflux, say at till about 10, 11 months. Phasic bite reflex is nothing but whenever you put anything in the mouth, they will just start chewing reflexively. Now, this is how
Right.
they learn how to chew. Now, once they are 10, 11 months, it slowly diminishes and then disappears. Okay. And say you are introducing textures or finger foods after 1 year. I've seen parents do that after 1.5,
Yeah.
2 years also. Now, here the child has to learn chewing voluntarily. This reflex is gone, right? And after 1 year, what happens is they're more aware of the surroundings,
Yeah.
they're more aware about likes and dislikes. So acceptance becomes very, very less. So this is the window for you, that is 6 to 10 months, to introduce all these textured food, right? And they will gag. They will gag, that will happen, but then they need to learn how to manage all this textured food in their mouth, right? Now you have to challenge their oral motor skills at every stage. Now say you're going to gym and you're working out with 1 kg weight and you're just doing it 1 kg weight, 1 kg weight, you won't progress. You need to challenge yourself. That is when you will reach 10. So similarly, food also is like that. Both, I tell parents, consider your mouth is a gym. You need to give that challenge. That is how they learn. They will gag, right? But they will learn. So yes,
Yeah.
that window you should not miss. Otherwise, it gets difficult.
Yeah, and I think it's just that us parents, we just panic too quickly. So I tell my clients, look, okay, start with smooth puree, no problem, because, for a lot of us, we need to get comfortable with the idea. But the main thing is, after a few weeks, once your baby is swallowing that well, doing that good, slowly increase it. It's okay, take your time, but you have to slowly challenge. If you give your child something and they're coughing throughout the meal, they're really struggling, okay, maybe they're not ready. But if in the beginning they're gagging a bit, but then they're okay, you have to keep to it. And, we have to remember the gag reflex is in front of their mouth, right? That's what's protecting food from going to the back. It's preventing choking, and that is there from the 6 to 10 months. So we should take advantage of that at that point. So I tell parents, look, we shouldn't let our kids be behind just because of our fears. Instead, we should try and educate ourselves. If you're worried about choking, learn the difference between choking and gagging. Take a CPR course. But for our kids, they say that 6 to 9 month window is so important for their taste buds, for their gut, for all of that. So, yeah, I think in terms of moving for the texture, I think it's us as parents that we have to be okay with that challenge. And for all you parents out there who are nervous about that, just remember that milk is the primary source of nutrition in the first year. So don't worry about quantity, right? Focus on building the skills of eating. That is what is going to take your child far, because we've all seen with kids, once they turn one, they run, they learn the word no. But if you set the
Yes.
foundation right, it'll be so
It's
much
the same
easier
with
to,
the
yeah.
exactly, and it's the same with the varieties also. I see so many parents
Hmm.
till 9, 10 months they just give that ragi porridge, ragi porridge, ragi
Yep.
porridge every day. Now,
I know.
in the first year, I tell parents you have to just make a note, keep a note of maximum amount of different varieties you can give them. So
Yeah.
that also is very very important. The flavors.
Yeah, yeah. So even for the clients I work with, we are starting with seasonings from the beginning. We don't follow
Mm-hmm.
the 3 day per food rule. You don't
Ah,
have
yeah.
to do all of that, So we do give variety. And if you're nervous about constipation, gassiness, okay, you can do 2 days per food. You can take it a
Mm-hmm.
bit slower, but don't do the dal rice. I know like khichdi is like that food that, okay, lunch, it's
For
going to be
months, yeah.
that. And I understand it is a superfood, it has everything our kids need, and it's a staple in the house, but we have to give that variety, because they'll also get bored of it, we'll also get bored of eating the same thing every day. Okay, I want to ask you about one other thing a lot of kids do. So let's move a little bit into the toddler phase, because if parents have a toddler and they're struggling with meal times, I want to discuss some of the concerns they have. So one thing I know a lot of toddlers like to do is they'll put food in their mouth and then they'll keep it in their mouth. This is called food pocketing. Why do they do that?
So many reasons. So common thing it is normal developmental phase. Okay, they're more, especially toddlers. They're more distracted, and some parents that's the time when they come up with screen time so that they're distracted and
Yeah.
fed. When the child is distracted, instead of gulping, they can even pouch the food. That's one reason. And
Mhm.
of course, when you're giving any new texture or any new food, that's one reason when they can just keep it in their mouth. And
Okay.
of course, pouching can happen because of oral motor issues. It can happen because of sensory issues. Sometimes it can happen because of painful swallowing, especially for kids who have this tonsillitis and swollen adenoids problem. They associate swallowing to pain. So these kids might just they're scared of swallowing and they might just pouch food in the mouth. And any traumatic eating incidences that has
Yeah.
happened, like choking or force feeding, or
Yeah.
if the child is not hungry, sometimes we don't follow the routine. Sometimes parents just keep feeding the baby every hour, right? If the child is not hungry, you're not following the routine, they might just pouch it in the mouth. And we don't think about the routine, we just want them to eat, and they're
Yeah.
like, okay, my child is pouching. So you need to
Yeah.
see the overall picture.
Right. I think the most important thing is understand why. Why are they doing that? And I think for food pocketing, a lot of times it's because they just, a lot of times it could be also because they don't know how to chew the food, or they've not had
Mm-hmm.
enough practice with that as
Exactly.
well. So they just kind of don't know what to do. So they
So
keep it
yeah,
there. Yeah.
if you have given them say purees till 1.5 years, and then suddenly you give them a dosa or a chapati, they're clueless. What am I supposed to do? It'll be in the mouth, or
Hmm.
chances are they'll just spit. spit that out.
And there's all these concerns that parents have, like, oh, my child is not chewing, or they're pocketing food, or they're doing this. Now, I know that I've worked with you, I've spoken to you as well, because my son had a lot of gut issues. He had a lot of sensory issues with eating, and it reflected meal times. And I remember some of the tips that you gave, which were really, really helpful. I know one of the tips you mentioned, especially if you notice your child doesn't want to swallow, is showing all of these signs where they're uncomfortable at meal times. I think one thing that really helped was an electric toothbrush, getting that stimulation before meal times, because a lot of times when kids feel something in their mouth, they panic. But if before that you use an electric toothbrush and you rub it in their mouth, it just kind of, maybe you can explain it better, but it stimulates, it just kind of gets them ready, a little bit more comfortable.
So again, when you say this vibratory inputs, it is very child specific, okay? Because sometimes kids, when parents hear, okay, vibratory toothbrush is going to, this needs assessment, because if a child is hypersensitive, this might really overwhelm him, or it might, chances are that your child
Backfire.
might drool more, or if, say, the child has a history of epilepsy, this can cause seizures. So you need to be very careful what to advise to what child. So if a child has, hypersensitive, and that also can be a reason why the child is pouching food for to stimulate and to just wake up this sensory system in the mouth, we do this we use this vibratory brush. But then again, just don't do it without
Yeah.
getting assessed, so it can backfire.
Sure, sure. Yeah, because I think each case is so different. Do you have any general guidelines of, if a parent is struggling with feeding issues with their toddler, in the sense that, they don't want to touch food, they don't want to put it in their mouth, they're spitting everything out. Like, I get that a lot. They'll put it in their mouth and suddenly
And
they'll
spit.
spit it out.
Yes. So see, basically, like I say, all the parents, that every child goes through a phase of picky eating and being very specific
Yeah.
about food, being choosy, especially after 1.5 or 2 years, till the age of, say, about 4 to 5, right?
Yeah.
And 90% of the time, they don't have any underlying issues. It's only about the 10% of the kids who might actually need feeding therapy as such. But then most often it is about what the meal time setting is like, home
Yeah.
environment at home, how is your approach, what is happening during meal times. Because for a child, say the child is going through a normal developmental phase, maybe teething, or the child is sick, or the child is going through new food phobia, during the appetite drop, for whatever reason they are going
Yeah.
through this appetite drop, and you're literally force feeding your child. Now, feeding this experience in a whole, as a whole, can be very traumatic. Now,
Yeah.
every time during meals, the child is going to get reminded, okay, this is meal time, this is how I should feel. Increase of cortisol level, the appetite is gone. So, first thing is, be very neutral. I do understand that it can be very triggering for parents when they don't finish that one whole bowl of rice, because again, we decide the quantity. We don't let the child decide for us. The child has to finish that one bowl of rice. Otherwise, somehow you distract and somehow spend 2 hours for each meal time and feed them. So give that control to your child. Let meal times be positive. There will be changes in appetite. There will be appetite drop. Keep a check on their weight. If your child is not losing weight, or if your child is hitting all the milestones on right time, you actually, and if the child is active, you don't have to worry. So this is one main thing, regardless of your child, if your child has underlying issues or not. This is one thing that you need to follow your approach. Even if a child has oral motor or sensory issues, that itself can make mealtime battles much mealtimes more relaxing. And
Yeah, I think we have forgotten as parents what mealtime is about, because we've been so stressed about finishing a certain amount that we will do anything to make that
our
happen.
expectations are always high, that
Yes, than the
that
reality. And yeah, and I'm sure you feel this as well, because I feel like when I'm guiding parents, it's not what the baby does, but it's how we respond as parents. So I do feel like in the end I am kind of coaching the parents to respond the right way, to create that right environment. Because even for me at that time, when my kids just stopped eating when they were 1.5, I was panicking and I get pissed and I'd say, okay, fine, just read a book or just watch something just to get it done. But then when I started to understand why, I realized, because end of the day, if you're in an environment where you're being forced to do something you don't want to do, you're being uncomfortable, you have maybe some sensory issue and they're not understanding you, then who's going to want to sit there? No one.
That's
We
very true.
wouldn't.
Yes.
So I say that, and when I understood, and like now, even with my kids, of course, they are still picky. They do want certain things or not. But when I sit with them at meal times, I try and make it happy. I try and make it fun. I try and not focus as much. I do remind them, okay, let's get back to our food, because they're kids, it's reality. But I do try and remember that it is about building memories and creating. That's what mealtime is about. I think if your child is struggling with a certain issue, first look at the mealtime environment. Are they still too
Exactly.
full? Are they having too much milk? Are they comfortable on the chair? Is it too much pressure? Is it too much food in front of them? I think first looking at the basic setup can
Yes, the routine
already, I
as well,
think,
Your
the
child, is your
routine.
child
Yeah.
grazing, because the child a meal, you're just feeding
Hmm.
one piece of this, one piece of that. The child is grazing. It is going to
Right.
impact the next meal as well. It's like a cycle.
Yeah, so I feel that if we just look at that, then we don't have to rush to these assumptions that our kids have some sensory issue or something. Most of the time, as you said, it's just about the environment that we have set up as parents. And I think that's what we need to focus on. So I think that gives us also a sense of relief that, we don't have to jump or panic in in these situations. I want to ask you about water and cups and bottles. There's this whole phase of our kids start with the bottle and then they start with some water. Now I have so many parents who struggle with their child not wanting to drink water in an open cup or a straw cup. Is this a sensory issue? Is this a problem? Do we just need to get them to keep practicing? What is your experience with, because post one they need to have a certain amount of water. So I generally tell my clients open cup and straw cup is the best, but there are
Mm-hmm.
some kids who refuse. Any
Mm-hmm.
tips for that?
Many toddlers and preschoolers, somehow they don't drink enough water at all, and forget
Yeah.
them, I think not many adults have enough water too. Right? So I tell parents that, role modeling, again, it starts with you. So make sure
Hmm.
that you drink enough water in front of them. Keep a bottle for you, keep a bottle for your partner, keep a bottle for your baby. So, keep sipping in front of them, and start make a water drinking routine. Like, once you wake up, drink some water, even for toddlers and preschoolers for that matter. Before you go to play area, drink some water. Once your nap time is done, have some water. So make it a routine so that your child knows, okay, when to sip the water. Like, simple routine. And
Yeah.
then some kids don't like the taste of water. You
Yeah.
could use infused water, infuse it with some chopped
Yeah.
fruits, lemon, mint, cucumber, strawberries, kiwis, just to give that subtle flavor or
Yeah.
subtle taste. If they don't like the taste of water, you can give them some frozen berries in a cube of ice. That also works. Toddlers and preschoolers, give some alternatives if they really don't like water, like buttermilk, chas, fermented rice water, jaljeera, or something like that. Give them water, rich veggies and fruits like watermelon, cucumbers, strawberries, tomatoes, all these things. Yes. Use some playful techniques. So I used to do this with my son, when he used to refuse to drink water. Whatever, sails your boat. So what I did was, I just took a favorite cartoon character of his, and I just stuck it on the water bottle. And I used to just tell him, oh, see, the Mickey is drowning. You need to save him. Drink some water. Drink it till his, nose. Drink it till his mouth.
Yeah.
So this worked for some time, of course. And we used to also play this water race, where I used to just slide some band with some animal, and I used to just tell him, "Okay, let's see who drinks first." So I used to just slide it down. So he used to take some sips. Of course, when he was 5 or 6 years old, this did not work. So when I said, your Mickey is drowning, he's like, let him drown. It's okay. Or, no, I don't want to win the race. So then I had to give him more logical reasoning. Right? See, if you don't drink water, your kidneys are really working hard. Look at the color of your pee. Your kidneys are working hard. So you need to
Yeah.
drink water. So when he drank water, it was a little clear, and he understood. Okay, so for him, it was that habit that once he goes to pee, he would come drink water. So the more logical facts worked once he was like 6, 7. So these are few things you can try for drinking, getting them to drink water.
So I think honestly, to summarize our discussion, I think, the first 6 months really expose your child to as much sensory for all the different senses, just in the daily life. Talk to them, take them outside, show them flashcards, have the colorful toys, and engage them. And as you're approaching different milestones, get them ready for it, give them the teether spoons, especially when you start solids. And during the 6 to 12 months, really focus at meal times on sensory, on the touching and feeling and variety and textures, and be patient with them. And if you have a toddler and if you're struggling with any of these sensory issues, I think the main thing is, number one, remember that they're going through major developmental phases. So understand that first. I think second, I
Yes,
know you mentioned this, food neophobia. All kids go through this phase where they suddenly have this fear of certain foods, even foods they used to love, because they're questioning everything around them. So don't panic, don't force. One thing that really helped my kids was food play. So when they were anti veggies, I started to get them to play with the veggies, like cut it, chop it, make it into shapes, paint with it, so that they could reconnect with that fruit or veggie. And then I would just
definitely.
start putting one small piece at meal times and asking them to give me a bite, to kiss it, to make it stand. They do go through a bit of this fear of foods, which is normal. But the main thing to know is that most of the times, hopefully, it is just the environment and us needing to step it up a bit. And if you feel that your child, you've done all of these things, it's not working, or you have that feeling that they do have some sensory issues, you can definitely reach out to Tara and she would be willing to help. And we'll
Yes,
put her
definitely.
details down below. If you could just let everyone know in terms of how do you help, how can they reach out to you?
So yeah, they can reach out to me through Instagram, or if you don't have Instagram, you can just share my number and you can just DM me. So I will get in touch with you. So we do follow a protocol for assessment and some filling up of the meal chart and the videos that I'll need. So once I have that, I do a detailed assessment. Now, when I say assessment, it's not only about how the child is eating just by looking at the video, right? We start from the time of birth, right? What kind of birth that was, what happened, how was the breastfeeding, was there reflux? Every minute detail will be covered and asked, so that we don't miss out on anything, right? So
Right.
with these details, you get to know, I generally get to know if the child has any restrictions, and then I ask the pictures of the mouth. We assess the mouth also. Most often this is missed. We just ask the question with the parents and we just see the videos, but most of them don't see the mouth, what is happening inside the mouth, right? So I ask for pictures of their tongue, their lips, their palate, everything. So once that is done, we again, I see the meal chart. So in detail, how the routine is, what kind of food the child is interested in, how many times the child is eating, what, how much milk the child is getting in a day. We assess the mealtime environment. What is happening? Is there any kind of pressure? So once we look into all these things, then the next session we will come up with the personalized plan for the child. If the child needs any oral motor or sensory, if the child has any oral motor or sensory issues, we work on that as well. We give them some texture progression. We work on texture progression. We give them some oral motor exercises, some sensory stimulation according to the child's needs.
Right, right. Okay, amazing. That seems very thorough and very comprehensive. So thank you for being here today. It was lovely chatting with you.
Thank you so much for having me over.